welcome to another episode of Let's Talk. I'm Jade Harrell, and I'm joined by Amber Clear, Amy Rivera, and Miss Teena Love today. Hello, ladies.
Hello.
Hey.
Welcome back. Welcome back. Well, I'm loving seeing you again. What are you loving, Amber?
I am absolutely loving the outdoors, the frozen waterfalls. Missouri is rich with like national parks and state parks and just beautiful outdoor places. So I am loving the outdoors and the calmness that it brings, and the closer it brings me to whoever I go hiking with.
That's fantastic. How about you, Miss Teena? What are you loving right now?
I'm loving quality time and spending quality time with family and people who are important. With the last 2 or 3 years we've had, we've lost a lot of people, and I think it's made us really appreciate folks that are in our lives and to spend that time with them and enjoy it when we can. So, that's what I'm loving. I'm loving quality time with people, family, friends.
Well, I most certainly second that. How about you, Amy?
I've had a busy year, and so like the two other ladies, I am enjoying my time on the farm, and I'm getting reconnected with my childhood roots, and I'm loving it.
It sounds like a lot of fun, and it's even harder to believe that we are entering our third year, ladies, of the COVID-19 pandemic. And just since the start of this new year, the positivity rate in St. Louis has reached its highest peak since the very first case was reported in March of 2020. We're also seeing the return of flu and other illnesses that were largely absent last year. So what can we do to stay healthy and safe? Well, our guest today is highly qualified to offer some advice. She is the new health director of the city of St. Louis. Please welcome Dr. Mati Hlatshwayo Davis. Dr. Mati, thank you for joining us.
Thanks so much for having me, but thank you even more for pronouncing my name so well. I am so used to having it butchered that it was more of a surprise to hear it said so beautifully. Thank you.
Well, I take that as an honor. It's really enjoyable to say for somebody who talks all the time. So it certainly was a fun treat. So Dr. Mati, clearly there's a lot to talk about with COVID-19 alone, but first we want to get to know you. Congratulations on your appointment. You took over as health director in October. When Mayor Jones announced that appointment, she expressed her confidence in your ability to take over this role and pointed to your background and extensive experience. Will you share more about that with us?
Sure. So I come to this position with a background as an infectious diseases physician. I also have a public health degree. So I am an ID doc who is passionate about public health. And I think, that amongst hopefully other reasons, but those are the main reasons that I believe I was tapped for this position. So a little bit about me. I trained in medical school at the Cleveland Clinic Lerner College of Medicine. I actually lived in Cleveland, Ohio for 10 years and was there when LeBron first came into the NBA. So I'm aging myself a little bit. Well, not first, no, but one of his first major contracts, let's be clear, because I was aging myself a little too much there. But so spent 10 years in Cleveland where I did medical school, stayed on to do an internal medicine residency at Case Western Reserve, also in Cleveland. And that's where I also got my public health degree and did some research. Followed my husband. At the time, he was my fiance. So, we tell young women to never just follow men around recklessly, but I did have a ring on my finger at that point, and he was a resident in pediatrics at SLU University. And so I came here to do my fellowship at Washington University in infectious diseases. And then for me, the pathway was always clear. If you go into infectious diseases, you are the sort of person who thrives in these times. We do epidemics and pandemics. In fact, I always talk to people about my young children because all my pregnancies were associated with some sort of big pandemic or epidemic, right? So my first year in Cleveland, I was a young, bright-eyed, bushy-tailed fellow, and it was Ebola. And then our pregnancy with my first child, who's now 5, it was Zika. And I remember I couldn't just go to the OB visits and talk about my own pregnancy. I would spend a little bit of time having them consult with me about what to do with some of their pregnant patients around Zika. And then I had my own pandemic baby last May, who is now 1.5 years. So it's part of the job. It's part of the life when you're infectious diseases. This is what we do. We don't have the luxury to only deal with one aspect of medicine or one part of the body. We have to know it all because infections don't pick. But from how I was born and raised, I'm originally from Zimbabwe, which is why, I'm always impressed when people can say my name because it's not phonetic in English. I knew then that if you want to care about the most marginalized, the most vulnerable, public health is important to focus on. So I wanted to pursue public health, and that's really my passion. I do community engaged work. I care about the care of the most vulnerable communities, the most marginalized communities. And, was really excited to start in October.
We are so excited to have you, Dr. Mati, and what an incredible story about each childbirth. There was another pandemic or infectious disease that needed some real attention and resolve. So let's talk about the present one of today, Dr. Mati. Public health, a background in infectious disease. What do we most need to know right now about COVID-19? And how can you help us work through this time?
Yeah, it's tough, because I feel strongly that as a nation, as a planet, we should not be still dealing with this at the position we do now. We know enough about viruses and virology and pandemics to know better, to know better. And so I make no excuses for the fact that the public has been failed at multiple points by this, but it's still my job to respond and to give the very best available advice around this, right? So I want to be very clear, though, that I come into this not believing that COVID should be the be all and end all of public health. And I think a lot of people are tired of that being the case. It's just not true. Non-COVID priorities for me are as much of a priority as COVID, and we need to be given the space and the resources to treat them as such, right? People's diabetes and high blood pressure and mental health did not go away. If anything, they've been exacerbated by the fact that people haven't been able to deal with them during a pandemic. So I want to empathize with, I hear a lot of, I'm so tired of hearing about COVID. I'm so tired of only focusing on COVID. And those people are right? That shouldn't be the approach. The approach is not just COVID, but at the same time, I don't have the luxury to deal with one or the other. I have to kind of deal in both in parallel, right? So in looking at where we are with COVID, we are at the worst place we've been with COVID since we started. Unacceptable. 2 years in, we should know better. And that's because we have 2 very highly transmissible variants in play in Delta and Omicron. They spread very fast. And whether or not, because I keep hearing the word mild associated with Delta, with Omicron, I beg your pardon, whether or not it can cause mild illness in an individual doesn't matter at this point. So many people have it that the few people that would have had severe disease in a smaller number are a much bigger number when more and more people get COVID. So what does that mean? We're seeing our hospitals overwhelmed. And so people who are ill for other reasons, need surgeries, need critical care for diseases completely unrelated to COVID are being affected. So whether or not you're tired of hearing about COVID, you should want me to be addressing it, want the federal government to be addressing it so that we can address the things you do care about, right?
Well, I have a question.
Where we are.
Sorry to interrupt. I have a question for you. So it seemed like infectious disease would put you at risk a lot in your career. What made you choose that field?
What made me choose that field was some of the things I saw growing up. Infectious diseases impact a lot of the most low-income countries, right? Whether it's malaria, tuberculosis, and then I saw HIV sort of come to my country in ways that it came to other countries and really decimate an entire working force, left young children orphaned, and was devastating. But I just love the physiology. When you do medicine, you kind of pick what matches your personality, what you love to read about, would love to study. For me, it's infections, as crazy as that sounds. And you take that risk on, but you also become an expert and know how to protect yourselves, and then use that knowledge to expand to how you can help people protect themselves and their communities.
Are you ever worried about bringing something home to your family?
Always. It's terrifying. But do I stay home and not do the best for my communities because I'm afraid for myself? No. So I protect myself and my babies the best way I know how. And I use that passion to do the same for the communities I serve.
Mm.
Mm.
Well, we need to take a quick break, but Dr. Mati is going to be staying with us. And I know that Teena and Amy have questions as well. Dr. Mati, thank you so much for putting that in perspective. And to hear your commitment, even though the risk is high for you and your children, your commitment to the community's children and us as a unit, as a unified group of people, is even more inspiring. So don't go anywhere if you don't mind. Stay with us. There's more Let's Talk right after this.
I'm Jenny Garth, and as a mother of 3, I know kids worry about a lot of things. Getting enough food to eat shouldn't be one of them. But here in America, that is a real worry for 1 in 5 children. This is unacceptable, and something Feeding America is working to solve. Through a nationwide network of food banks, Feeding America serves virtually every community in the United States, including yours. See how you can help your community. Visit feedingamerica.org. Together, we can solve hunger. Together, we're Feeding America.
How can I help my daughter with her reading?
Searching for help with Dachshund breeding.
Why do you not get me?
I do. This is what it feels like for kids with learning and attention issues. Redirecting to understood.org.
Join parents and experts at understood.org, a free online resource about learning and attention issues to help your child thrive.
And welcome back. We've been talking with Health Director of the City of St. Louis, Dr. Mati, and we don't want to waste any time, so let's get back to it. We'll start with you, Teena. I know you've got some questions as well.
Yes, thank you so much, Jade, and Dr. Mati, thank you for being with us. It's interesting, the 3rd year in, and we're still having conversations with people who are saying that they don't believe the mask is effective or that we shouldn't wear masks. I was on a plane not long ago and I saw an individual who had a mask on, or some other people too. When he coughed, he lowered his mask to cough and then put his mask back up after he was done. I know, Amber, I know. And I saw other people doing the same thing. So Dr. Mati, could you please just share with us the importance, first of all, of the mask, how it works, and then can you share what is the appropriate way to wear a mask? When you cough and sneeze, should that mask be over your face, or is it okay to take it down while you're on a plane, especially, and cough and sneeze and then put it back on? I just want to make sure that we clarify that.
Seems like such a simple question, but it's such an important question. So let's start with the science, and then I'm all about accountability. So let me tell you where I empathize with the public and the naysayers, because I actually do empathize with the naysayers. Okay. They're wrong, but I'm still empathizing with them, and we'll talk about why. Okay. So the first thing is masks work. We have local studies that show it from both our academic institutions, WashU and SLU. We have state level data that has been released. We have national data that has been released. We have people whose job it is to do this science who have validated that masks work. There are varying degrees of efficacy of masks. So I think a lot of times when the public doesn't like the message they're getting, some people like to say it's all or nothing. People are getting COVID even after vaccination, so vaccines don't work. That's not how medicine works. There is not one medicine, not one vaccine that is 100% effective. That is science, that is medicine. So I come from the viewpoint that I would want to have anything available to me that could decrease the risk of me getting something bad, from me getting very sick from something bad, and from me dying from something bad. That is what vaccines do. That is what masks do. That is what social distancing does. That is what hand washing does. And the more of those things you do properly, the less likely you are to get sick or to get very sick or to die. Does that mean you will never get sick if you do everything you're supposed to? No, life is not fair. Does that mean you may not get very sick if you do everything you're supposed to? No, that is not a guarantee. But in my book, that doesn't mean throw away everything. It means put yourself in the best position possible. So in specifically related to masks, masks should be worn. We have on our website, I would really tell people that I've worked very hard to update the city's website so it has some of this information that people have wanted. And what we've done is we have put in order of efficacy, in order of what is the most effective mask to the least effective mask. We have given you guidance on what to look for when you're ordering them, right? And the quality of those masks. And unfortunately, in this country, which is unacceptable, not everybody can get the highest grade masks. That should not be the case. I will hold our government accountable for that, period. No excuses. When you are wearing that mask, it should cover your nose, because when the virus, which is an airborne disease, when it comes in particles through the air, it lands and resides in the nose, which is where it takes up root to the rest of your body. So the nose is one of the most important places that needs to be covered. The mouth, because that is how you expel it to other people, must be covered. And you want to cover as much of this area through the sides, because again, these are miniature particles that can escape easily. So you want a tight-fitting mask. When you cough into a mask. Nothing bad will happen to you. We teach our kids. I have a 5-year-old who does a better job of this than most adults. She will cough into her arm. She will keep a mask on. Nothing bad happens and it doesn't put her in any danger. In fact, we've been showing that that's a polite way to be around other people since the dawn of time. Now, where I'm going to hold us as the public messengers accountable is I don't know that we have done a great job of making the public understand that this is not an all or nothing game, that we haven't done a great job of making sure the public understand, what is most effective and least effective. And really that we haven't done a great job of making people understand that infectious diseases are not static. They're not the same in January of 2020 all the way through 21 to 22. They're not. So guidance changes too. Sometimes we had great enough numbers that we were able to come down on things, and other times we just didn't do a good job staying on top of it, so they come back. That doesn't mean they lied, masks don't work. No, it means guidance change as time changes and as diseases evolve. I hope that helps a little bit.
Fantastic. Thank you so much for that answer.
And that was going to be my question, is how do we effectively communicate the guidance changes to the public? Because I wish you had answered my question about when infectious diseases change, the guidance change. And I think the community is just so confused. Like you said, it's either all or nothing. And that I feel like is doing more harm than good in our community. So thank you for addressing that.
Mistakes have been made. Mistakes have been made. I think at the beginning of the pandemic, we could have done a better job in the scientific and public health community, especially at the national level, of saying, listen, we are giving you the best advice, the best recommendations we can do for now. That may change over time, and this is in response to this. I also think we could have done a better job being more transparent about certain things at certain times, but I also will very much defend the CDC and some of the people that have gotten us through this in saying, no one is perfect. No one can give everyone how they want it, when they want it. And at some point, individuals also need to take responsibility for, am I just picking? If they say this, am I going to pick at that? If they say that, am I going to find something else to pick at and find something else? At the end of the day, I think we should all prioritize what's most important. And that is, we don't want to see anyone sick. We don't want to see anyone die. And so what can you do as an individual to prevent that? And what can we do as a community to prevent that? That should be the bottom line. But yes, I will absolutely stand on two feet, 10 toes and say that there could have been a better job in how things were communicated over the time. And even I as a local health director, have been frustrated at times. I will, however, never vilify the CDC, because without them, we would have never been able to get through this in any sort of decent way.
I mean, I also think that we're at a point of like pandemic fatigue, and people's mental health is wearing thin, and you have to be able to justify, like, at what point does mental health weigh over COVID and everything else that's out there? Because that's hard.
Absolutely. And this is the part when I spoke in the beginning about, we have sometimes had to put aside some of the other things that are equal priorities in this, mental health being one of them. I would argue mental health has gotten worse and worse and worse throughout this pandemic. And so, you know, those of us in the medical community and the public health community do not have the luxury of putting it aside. We have to be acknowledging that those things happen. We have to do the best with what we have, but we do need to hold our government accountable, because this is the #1 world superpower. There's no reason why every household shouldn't have an antigen test, shouldn't have an N95 mask. There's absolutely no reason in my mind at this point, given my level of expertise. So my job is to focus on the positive, focus on what I can affect for my local community, and then advocate and hold those higher than us accountable as to what the priorities should be.
When do you think this is going to be over? Or do you think it's just, this is our new way of life? Like, is there an end in sight?
So I've been very clear about this. COVID was never going to magically go away. We should have made that clear from the beginning. Now, the new normal could have been a much better place than where we are now if we reach herd immunity. Herd immunity was always the goal, and should have always, and is always the goal. Unfortunately, more than, close to 2 years in, we haven't gotten to herd immunity. So that means we have this waxing and waning cycle of really bad cases and hospitalizations and high numbers of deaths. Versus not, because when you don't get to herd immunity, it is a breeding ground for new variants that figure out a way to evade our current vaccines and have an ability to spread faster and make people sick. So the goal must be herd immunity. Without it, the new normal will always feel like this, where at every couple of months, it sounds like we need to shut down again and put all these measures in place. In countries where this has been done well, they are at their new normal. They are able to do social activities. And sure, some things have changed, right? And certain restrictions should stay with us moving forward, because they've helped with other things. We haven't seen flu this low in years, because masks work for all respiratory diseases, right? But we should be in a better place, and that place should be herd immunity.
Let's talk about what herd.
Dr. Mati, I want to close out our conversation with that focus on the positive. One, because we could use the encouragement, but two, in really making sure that we know that information is updated and your guidance is updated. Celebrating and being able to acknowledge the accomplishments and the things that are working, I do believe will also help with that appreciation. We advised this and this worked. Will you close with some of the successes that have happened and the things that are looking very promising as we're going forward before we leave?
Well, the city has just opened 3 new testing sites just this week throughout the city of St. Louis, because people have had a really hard time getting to tests. We need to stay away from emergency rooms. People are desperately going to them, and that's making them unable to take care of very sick people. So that's great news. We have 3 more, and I think even more I'll be able to announce next week. So working on that. The city will be purchasing at-home antigen test kits and masks, and my hope is that we can get those to the most vulnerable. I will never lie to you and say I'll have enough for every single individual, and I believe I should. So I hold the government accountable for that. The other things is, I believe in communities. I believe, I've been on a call right now with 3 beautiful, positive people who I know care about themselves, care about their communities, care about their families. And my hopeful message is, if we continue to make that the priority, we can get through this. So I would encourage you to visit our website. We have testing locations. We have vaccination events ongoing for first doses, second doses, and boosters. We gave 180 doses of vaccines last Saturday, and that's 2 years in. And I always hear that people are tired and aren't listening, but there are people who want them and are listening and are protecting. So go to our website, follow us on all our socials. We're on Twitter, we're on Instagram, we're on Facebook. We're trying to keep up with the youngins and the middle-uns and the oldins. And so we're not on TikTok yet, but we're working on it. So just follow us and keep up to date. Our website will get you the information you need, and hold us accountable just like we continue to hold those above us. Thank you so much for this time.
Exceptional. Dr. Mati, thank you so much for joining us today. You can find up-to-date information and resources on COVID-19 and more on the Department of Health's page at stlewis-mo.gov. And be sure to follow the City of St. Louis Department of Health on Facebook, Twitter, and Instagram. You can also find us on all those channels, as well as YouTube and at stltv.net. I'm Jade Harrell for Teena Love, Amber Clear, and Amy Rivera. We'll see you next time on Let's Talk.
We'll get
Why y'all gonna make me cry on the
your family and yourself, but
why y'all gonna make me cry on the set? Y'all gotta keep it. I was about to start. What you want me to do? Boo hoo hoo on the set? Come on now.
So I also wanted to make a joke about maybe you shouldn't have any more kids if every time you have a kid,
that's my joke. That's literally how I break the ice with patients. Is I was like, so I probably should stop getting pregnant because every time I'm pregnant, we got a pandemic or an epidemic.
At least I can warn us so that we know.
I think that's the answer, because every time we've had a pandemic, you brought a next new answer and solution to the world. So as far as I'm concerned, stay fertile. For whatever.
So now that's a whole other conversation for my husband. I don't know if my husband wants to keep rolling this dice and having more women in the house.
Y'all got it. It's a
No
one-stop
man in the
shop.
house, child.
Oh
You
my
got
goodness.
the pediatrician right there. There's no
Yeah.
problems here.
Yeah.